Thank you for joining us this afternoon. Welcome to our friends from Miami-Dade, as well as all over the state of Florida, and to those across the United States and several foreign countries. I'm Kyle Siebrecht, Executive Director of Strength in Numbers, Power in Connection. From the pandemic to political upheavals and racial unrest, economic strains, and climate change, many of us are dealing with more stress, anxiety, depression, or trauma. Many are seeking help from mental health care professionals, and perhaps for the first time. Our panelists this afternoon are here to guide us in our search for the right kind of care and the best mental health care match for our individual needs. Our first panelist, Pilar Tamburrino, Assistant Director, Faculty and Staff Assistance Program, Miller School of Medicine, University of Miami, nicknamed the Mental Health Care Matchmaker, will share with us her special sauce recipe for matching patients with healthcare providers, as she has done for hundreds of employees. Then Marlene DeLima, founder and CEO Changing Perspectives, will offer parents advice regarding mental health care options for children and also inform us regarding mental health in the Caribbean American and Black American communities during the pandemic. Then Kathy Coppola, Executive Director of NAMI MiamiDade, that is the National Association on Mental Illness, will introduce us to the programs and options with NAMI. Then Sandra L Brown, whose groundbreaking research pioneered the field of narcissistic abuse and relational harm, has now turned her attention to trauma and is turning trauma treatment on its head. She will share her new observations and advice in this area. Before we begin, I want to remind you that before searching for a mental health counselor, the first step is to contact your health care insurance provider and check your mental health care coverage. Then go on their website and look for a listing of mental health professionals that are covered by your insurance in your area. You may also want to refer to the NAMI webpage, which gives you information about the various degrees and certifications for mental health professionals. That link is in the chat now. After the program, there will be a quick break while we grab our tea, juice, or wine, and then enter the Mindfulness Lounge for a lively interactive Q&A session when you may address questions to any of the speakers. After this session, check your email or check the chat for the link to join us in the lounge. This is our first Q&A lounge, so we are inviting everyone to join us for free to ask your questions. This program is being recorded. This presentation is intended for those 18 years of age or older, and speakers will give a trigger warning as appropriate. Now, let's begin the program with Pilar Tamburrino, MS LMHC.
Kyle, I want to thank you for the invitation to be a panelist. I think this is a wonderful forum, and I think it's a wonderful topic. The more we talk about mental health, we should be talking about it like we talk about our blood pressure or whatever we nourish ourselves with, our physical exercise. We have to be talking about it. And these kind of forums and open conversations lead the way and lead the path, right? So a little bit about me. I have been a licensed mental health counselor for 29 years. Yes, I date myself, 29 years. And I have been with the University of Miami for 13 years. I am the assistant director, and I work for the Faculty and Staff Assistance Program, which is normally known more like EAPs or Employee Assistance Programs. So my role or my job is to support the faculty and staff and their family members So we're kind of like the middlemen or the middle women, right? We are the middle person when faculty or staff are going through any kind of presenting problems, whether it's workplace or whether it's personal with themselves, with their families. They reach out to us and we offer some kind of conversation, assessment. We meet with them a couple of times, and then we make the appropriate referrals to the health plan. So I'm glad that you mentioned at the beginning about the health plan, because it's very important to be familiar with your health plan, to be familiar whether your health plan has a third party that manages mental health and substance abuse benefits. And in our role, we like to actually personally know the people that are in our panel. So we kind of do audits, or prior to COVID, we used to go and visit the providers and meet with them, get not only what their expertise is, but also a little bit about their personality. So that's my role.
Okay. How do you match patients with counselors so well? Do you do it by age, by gender, by ethnicity, by mental health condition, or do you use some other assessment tool?
Well, Kyle, you're the one that labeled me. What was it? The mental health care matchmaker. So thank you for that. I think that's a very cute little phrase or label, right? I don't know if I'm the matchmaker, but I think after a bit of experience and being in the field and living in South Florida and being familiar with a lot of people in the mental health community, it's a combination of many things. Yes, of course, we take into account gender, race, we take into account culture, we take into account so many different things, but more than anything is also those interpersonal or personality traits of what the client is looking for a provider that has a certain expertise, but also has certain personality traits that are going to be a good match. Because therapy is wonderful, experience, all of those wonderful initials after your name are necessary requirement, but that rapport that you build with your mental health provider that provides that trust and safety for you to be open and to be feeling safe and talking about your deepest, darkest vulnerabilities, that takes rapport. So that's what I base it on. I base it on what I assess the client and the patient, what their needs are, what their personality is like when I meet with them those couple of times. And then I give them a list of maybe 2 or 3 therapists, psychologists, psychiatrists that I think would be a good match for their personality and for what their needs are.
And how should the patient assess the new counselor?
Well, there's so many ways now. I think now that we have so much technology, people Google all the time. Psychology Today lists a whole bunch of psychologists and therapists that are available. So you can go into their websites. A lot of these therapists have websites and talk about what their experience and expertise and what their licenses are. So, I mean, that's one way. For me, I think that's important, yes, but I think sometimes that also gives you a preconceived notion or perception of what that person is going to be like. So I always say, keep an open mind, be curious. My rule of thumb is go to a couple of appointments before you make up your mind and decide whether that therapist is for you or not, because you can have an off day, the therapist can have an off day. Remember, these are also human beings. So it's important to give yourself a chance to at least see if there is rapport between you and the therapist or psychologist or psychiatrist, if there is that sense of trust, of safety, if there is that sense of like, this is a person that I can relate to, that can understand me, that I can talk to about these things. So my rule of thumb is usually I recommend 2 to 3 visits or sessions before you make up your mind.
Thank you. And so should the patient, what should the patient do if it's not inappropriate?
If it's not inappropriate, I mean, if it's horrible. Like, let's say you have that one session, and that happens, you have that one session and you're like, oh, for sure, this person is not for me. This is not a good match. Then you go back to the drawing board. You go back to, we give 2 or 3 names. So I normally say, if the person is not for you after a couple of sessions, you can always reach out to me and we will go down the list to the second person. If you're not going through an EAP and you're going directly through the health insurance, and they send you a very long list based on what you're asking for of expertise, or maybe based on just your zip code, then you start going down the list, do your little research. I always say, you always have the opportunity also, when you call to schedule the appointment, to ask for a phone consultation, just to ask a few questions of the therapist prior to you going to the session. And now that it's so easy, because we have easy access, that most sessions are virtual now, not in person, that's even easier for you to have like a 5-10 minute conversation with a therapist, to see kind of in that small exchange or short exchange, you can kind of tell, okay, maybe I'll try this person. But the thing with therapy is that it's a process. It's not like an exact science where you can say, okay, I go to this therapist and that's it. It's going to be a perfect match. It doesn't work like that. So it takes a little work on your part, which I know is hard when you're going through difficulties, but it is important for you to have a good match, because that's going to be 75% of your treatment, is knowing that you're going to someone that you trust, that, again, that you feel safe, that you feel like you're not being judged, that it is confidential, that it is, everything that you want it to be when you're there.
Thank you very much, Pilar, for that introduction. That's very, very helpful. All righty then. Next, we welcome Marlene DeLima, MS, LMHC, and founder and CEO of Changing Perspectives. Welcome, Marlene.
Thank you so much, Kyle. Thank you for inviting me to be a part of this panel. I appreciate this, and I think it's important that we get the word out, like Pilar just mentioned. I think there's so much stigma associated with mental health, unfortunately, and it keeps people from getting the help that they really need. So happy to be a part of sort of changing that stigma and having people educate people on what this is really all about.
Well, thank you for joining us. You worked in the Miami-Dade school system for a long time.
Yes.
Do you have any advice for accessing mental health care there?
Absolutely. So by way of introduction, yes, I was actually an English teacher when I started in the public school system. I was at the public school system for 14, 15 years, and went into psychology and did some counseling. So from English to counseling in the school system. And within the Miami-Dade public schools, there is what's called a trust counseling program. And trust program provides a counselor specific to mental health issues. So you'd have your guidance counselors who deal with the guidance of in terms of academic scheduling and so forth. But you would have the trust counselors deal with just the issues of mental health, everything from running support groups with students to individual counseling, and of course, helping their families connect the students to outside help as needed. So I did that. And then from there, after a while, had opened my own practice, Changing Perspectives. And then when my now 22-year-old went off to college, I thought, you know what, I kind of miss the school system again. And this time I delved into the private school sector, where things are a little different, but the needs are still the same. And I avail myself there as a counselor, also as a school mental health counselor, while providing private counseling in my private practice. So I can tell you that for parents who are looking for help, like I said, not only is there a trust counseling program in the high schools and middle schools, but even within the elementary schools, if parents are looking for help, the counselors within each of the schools, meaning even the guidance counselors, have at their fingertips resources to point the parents in the right direction. so that if a child and or family needs additional help with counseling, they're able to get that outside. Because of course the schools are limited in terms of what kinds of counseling, and the duration of the sessions, right, per student, because there are so many students to counselors. But resources are there, and we certainly can point them in the right direction to get more help.
And what do you advise for parents in general seeking the best mental health care for their children?
So often what I find that I'm asked, right, in terms of, schooling and kids is, how can my child's struggles with learning, for instance, be helped? Or how can I find out if my child is ADD or ADHD, or if my child has any learning disabilities? And so one of the things that I would suggest is getting your child evaluated if you're in question. There's no reason to wonder and have that poor child struggle needlessly. Getting evaluated by a psychologist who could run various tests, sometimes a psychiatrist can do the same, to determine a diagnosis means that upon getting a diagnosis, these kids can have extended time. They can have special accommodations in school. They can have extended time for tests. And, the world of education involves so much tests, right? And you've got to take your standardized tests. You've got to, pass tests throughout your classes. So what's nice is that we've seen kids struggle initially, not do well in school. And it's really because they might have slower processing. And so upon getting diagnosed, again, they then are given accommodations in the school systems, which means the teachers know, this child needs you to give them a little bit more time to do the assignment, and definitely to take tests and the standardized tests. So then that becomes extremely important come high school, because you're talking about standardized tests like the ACT and the SATs that are required for them to then apply for colleges. So these tests are what they're looking at to gauge scholarships and to gauge entrance into various colleges. So that's such an integral part of getting into school and the rest of their education that, it'd be a shame to have a child's test scores not reflect what they really know just because they didn't get the right accommodation. So I think as early as a parent is wondering, something could be wrong, my child is struggling here and there, the earlier they can get evaluated, the better that it would be for their child. So getting tested by a psychologist or psychiatrist. And that's the other $1 million question is, what's the difference between a psychiatrist, a psychotherapist, a psychologist? That I'm asked often by parents. And just a quick, way of knowing, a psychiatrist is a medical doctor, and only a psychiatrist can prescribe medications, right? So that psychiatrist is the one that might suggest that a child may need meds, and prior to doing that, we'll run an evaluation of sorts to determine that. And sometimes it involves blood work and so forth also to continue and determine proper medications. But going to a psychologist who can also evaluate a child, the psychologist is also someone who can do that, as well as some psychologists can provide psychotherapy. So it just depends on the line of work of a psychologist. Whereas the psychiatrist's main role is for evaluating for the purposes of prescribing. So I like to remind parents of that. So licensed mental health therapists like myself, Pilar, we can do psychotherapy, which means talk therapy, various types of therapy as needed. And so that is something that most psychiatrists will recommend, that if you are prescribed meds, you should absolutely also be seeing a therapist to help you with processing the issues and not rely entirely on medications. So it's just a quick how to tell the difference in what our roles are.
Thank you, Marlene. And Marlene, would you care to give us a brief overview of how the Caribbean American and Black communities are faring regarding mental health through the pandemic and political turmoil and immigration crises?
Yeah, that's chock full there, Kyle. That's a lot of, that's packed. But I will say to you that throughout, I'll say a few things. First of all, as an American born to Caribbean parents, I can understand the difference in terms of cultural approaches to various things, cultural approaches to mental health, as we're talking about stigma. I think throughout the Caribbean, as well as even in Black American, as well as even our brown communities, Latinx, etc., Latina, even there are several. There's a hesitancy in going into mental health. There's this idea and concept that it's for someone else. It's for those other people. It's for people who are, losing their minds completely. They fail to look at it with the right, and I say they in general, obviously not landing on everyone, but for the most part, there tends to be culturally some reservations before approaching mental health. They feel like they don't need it. Why? There are several reasons. One is this idea that our village is our families. Our village is, technically is usually a place where you would then rely on those people for help. So it's tabooed in the community. And I say that to say that presents some issues when it comes to getting the help. Now, having said that, I, of course, have several Caribbeans, Black clients who know the advantages, the benefits of counseling and have come forward. And what we have found, just to answer your question, Kyle, as far as what they're going through some of the same things that everyone else has gone through, and that is adjusting to our new normal. And obviously at the start of this pandemic, how scary it was, and the sheltering in, where most people of all races had a front row seat to some of the issues that was in the home life. So whatever was happening at home, our children now had a front row seat to those issues, and it really affected them in a way, I think, that every family wasn't really familiar with, because now everyone was home together for quite some time. So I think all families suffered. Where it might be specific to, where it changes, I think, are people in terms of their socioeconomic. So if that's Black, brown, white, anyone in socioeconomically who were suffering and could not enjoy some of what other people could. For instance, schooling online, it wasn't equal for everyone, right? Some students didn't have reliable internet, and that separated those who succeeded from those who didn't. The ease in which students went through this pandemic varied. So I look at it through a lens socioeconomically, how that affected our students, right? As opposed to so there were some Black and brown students who went through that seamlessly if they fell within that socioeconomic level. But for the most part, those who are unfortunate, who were at a disproportioned space, they struggled particularly with that, because it meant home life, relying on technology, relying on having the space that the number of people in a home who were dealing with having to share internet. So, and as counselors in the schools, we saw that as well, the difference between students who had a home where they could do that and not be so gravely affected compared to those who didn't. So I would say the pandemic affected people. Obviously, if you lost your job, the impact of that to your mental health, the family dynamic changed drastically with this. And I would say across the board, because again, a lot of what you asked would require so much more time, Kyle, regarding immigration. Yeah. And what was the other one? Our political climate. I mean, lots and lots to say on all of those fronts. But just simply put, that obviously these things affect family life, affect the mental health of people, affect self-esteem, and all of those things require that people realize that, much like needing to go to the gym to exercise or lose weight, going to see a mental health counselor is an act in helping your health wherever you are in that spectrum. If your family's in dire straits because you're considering a divorce, or there's a death in the family, there might be a more 911 situation as opposed to someone else who doesn't quite have that 911 situation. But either way, it can all be very, very helpful. And that's what we hope to sort of put out in all communities, including Brown and Black communities.
Thank you very much, Marlene. That's very helpful, insightful. Thank you for sharing with us. And now I would like to introduce Kathy Coppola, Esquire. She's the Executive Director of NAMI MiamiDade. I would like to clarify here that NAMI is not clinical counselors for mental health care. Rather, it's family and peer-led support groups led by individuals with the lived experience of a mental health condition. To be clear, Pilar, Marlene, and Sandra are clinicians, and NAMI is family and peer-led support groups, which are free of charge. It's a good idea to consult with your clinical care provider or your counselor as to whether a support group would be advisable to play a role in your care. Kathy?
Hey, Kyle. Hi, everyone. I'm honored to be with you all today. It's a great group of women, just happens to be women who are also amazing therapists and do amazing work here in Miami-Dade. So thank you all for being here. And as Kyle mentioned, NAMI feels an additional need in the community. We work with counselors. We work with therapists. We want those who come to us to seek professional help. And we are peers and we are family members who are helping other peers and family members during their road to recovery. And so I myself, I'm a family member. And I was able to go to support groups up in Massachusetts when my brother, who was 29, a chemist for the federal government, just about to get married, stopped talking over the course of a week. And it turned out to be a mental health issue. So he was able to get some great help in Massachusetts. And about 6 years ago, I moved to Miami. I started volunteering for NAMI, which was almost non-existent here in Miami-Dade. And due to a group of parents and like-minded peers and family members, we restarted the organization. So 6 years ago, we had 2 support groups a month. Today, we have 9+ support groups a week. We also have other programs that I'll be happy to share with you. And I'm going to share my screen. All right, so we are NAMI MiamiDade. We are one of 26 affiliates throughout the state of Florida and almost 1,000 affiliates throughout the United States. We are part of a national organization, but each local affiliate works its own programs. So who we are. You're going to have access to this PowerPoint, so I'm going to go through it rather quickly, and you can always call us later for any more information. So our mission is to provide education, support, and advocacy for individuals affected by a mental health challenge and their families. And our vision is that those who are affected are going to have great information tools and have the availability for recovery. So just to give you one example, is one of the young men who helped to restart NAMI got sick while he was at Ohio State in a pre-med undergrad program and became very ill with schizophrenia. And jump forward, he became a clinician, a mental health clinician through multiple degrees at University of Miami. And he is now at one of the premier law schools in the country, and he's in my hometown, Cambridge and Boston, at Harvard. So recovery is possible, and we always have to remember that. This is just some slide photos about who we are and what we've been doing the past years. So statistics, so they're important. People love to see them. So I put them in here as part of our part of the PowerPoint, so you can all go through them, and I'm just going to make mention of a couple. So these are national statistics. I know that people on this webinar are from around the country. Florida for sure, statistics and pandemic statistics. And going back to The national statistics, I've highlighted some statistics, which is 1 in 5 adults experience a mental illness every year. And 50% of all lifetime mental illness begins by age 14 and 75% by age 24. So as a family member, you really want to talk to your teachers, the counselors at your schools, like Marlene said, go to see a therapist, or I'm sorry, a psychiatrist, and get tested, because early intervention does make a huge difference.
Are all of NAMI's services free of charge?
Everything we do is free of charge all over the United States.
Do you have to
So,
qualify?
no qualification. We don't ask. You don't have to even register for most of our programs. You do not need to register for a support group. Some support groups in the countries do require it. Here in Miami, we wanted to make sure that there was not one impediment to getting on a support group. So if you'd like to get on a support group, you want to keep your video closed, you can. We just ask that there are everyone that goes to a support group has that lived experience. So if you go to a family support group, we want to make sure you're a family member. If you go to a peer support group, the same way. We do require a phone call for our young adult support group. So we want to make sure everyone is between the ages of 18 and 28.
Okay, thank you. And what languages are support groups and services available in?
So most of our programs are in English, all of our programs are in English and Spanish. However, our helpline and our warm line, which is where you can talk to someone over the phone. We don't have a time limit, so you can talk for 45 minutes, almost as if you're having your own one-on-one support group. And we do that in English, in Spanish, Portuguese, French, and in a couple of weeks in Arabic.
Okay, and what is that number?
So our main number is 305-665-2540. That's our main number, and it will come in and you'll be able to talk to someone. And if you need, for instance, someone to talk to in Arabic, our Layla is starting with us in 2 weeks, and she'll be able to talk to you, and we can always take a message and call you back.
Thank you. Okay.
Sure. And so NAMI National has these programs that are already done for the local affiliates. So they've been, many are evidence-based, a number of them have been evidence-informed, and most NAMIs throughout the country do these national programs. And by the way, all the photos here are of our people. There are volunteers, there are staff, they have fun. You can see Chris and Fanny and Ali on here now. So besides the NAMI national programs, we can create our own programs, and we've been doing that. So of course, we have our own helpline and warm line. We have a new peer mentoring program. We work with the 11th Judicial Court, and many of you may have heard of the 40-hour training, CIT training for police officers. So we go out and we work with Habza Kaba on her amazing program, and Judge Leifman's program, which is just a model for other law enforcement around the world. So we also, when we started almost 6 years ago, we said, what are we going to do? How are we going to bring awareness to the community that we're here? So we started the Real Minds Miami Mental Health Film Festival. We give away 1,000 free tickets. And that really made a big impression on people. People were calling for tickets late, and it was amazing having it at bringing in food, people talking about things. I was on a call, I was doing a lunch and learn for American Airlines, and a woman got on the meeting and said, I've been to the film festival. It's amazing. It helped my family show me that I needed mental health treatment because I refused. And I said, this was not a commercial. I didn't set her up. These are things that are really happening when people can see and finally make clear that they do need help. We held the first walk for mental health in Miami-Dade. We held it last May, despite the pandemic. So it was a hybrid model. So next May, we will be holding the first walk for mental health, as NAMIs do across the country. And I'm going to make a personal invitation to all of you to come over and see us there. And so we have other things. We have community outreach. We have a number of MPH students who work with us. They do their practicums. And then we have the Advocates for Mental Health South Florida. So during the pandemic, and even before, we had made some steps forward, but now we have a group called the Advocates for Mental Health South Florida. And we are affiliated with the Florida Mental Health Advocacy Coalition to make changes here in Miami-Dade and in the Keys. And we work with other affiliates around the country. And right now, one of our biggest priorities is the new 988. Next, we have the support groups. So one of the things about support groups that I think is especially helpful is while you're waiting. So if you haven't been on a support group, while you're waiting to see a therapist, you know, we talked about it the other day, it could be from 6 months or to see a psychiatrist, or 6 weeks to see a therapist. Come on over, come on to one of the support groups, see if you like it. If you don't like the Wednesday one, try the Saturday one or the Monday morning one. And similar to what AA's been doing for, you know, decades and decades, you can now go, because of Zoom, to be with the Cowboys in Texas. You can be with the, you know, the skiers in Vermont during the winter. You can go on a support group anywhere in the country. And we have people who come from other countries, especially Spanish-speaking countries, who have very limited services. And we do not deny anyone, no matter where you're from, no matter how, you know, what your diagnosis or not diagnosis is. So we tell everyone, come on in, come over, talk to us. And if we can't help you, we're going to help you find someone to help you. We also have education programs. So this is a 16-hour program called Peer-to-Peer. You can look it up, read about it either on our website or on the PowerPoint that I'll be sharing. But it's a great program for people who have mental health issues.
Our next presenter is Sandra L Brown, MA, CEO of the Institute for Relational Harm Reduction and Public Pathology Education. Sandra? Sandra, are you with us?
I am.
Okay, here's your first question. You are renowned for your pioneering research, which showed that many women in relationships with narcissists were not codependent, but rather had super traits of conscientiousness and agreeableness. You have followed that up with seminal work on trauma. Would you briefly describe this work, please?
Well, I began focusing on that population because there was a lack of recognition of the level of severity of trauma in that particular group that was affected by that level of psychopathology. And I mean, it sort of stands to reason that what a narcissist or psychopath could do to you is probably worse than your run-of-the-mill unpleasant person. So I, 30 years ago, began seeing survivors coming out of that situation and recognize their level of severity. And there were plenty of stories about failed treatment of other therapists not recognizing their trauma because much of it has an atypical trauma aspect to it. And so really our work in this field, in the pathological love relationship field, has been focused on The super traits of personality, differentiating personality from codependency. A lot of these particular survivors have personality traits which cause them to be labeled, by mental health professionals as codependent. Codependency is related to, usually related to aversive childhood experiences, abuse, neglect, parental addiction, or other mental health problems. And a lot of our clients didn't have that history or background, which is why we hooked up with Purdue University to do a really large collegiate study looking at the personality configuration of these women and being able to differentiate that a lot of the empathy and compassion and tolerance that's often assumed to be codependency is actually a personality factor, not generated from a historical element, but innate. So that has been a big chunk, I think, of our contribution to the field, as well as going on to do trauma studies with these this particular group and understanding the atypical factor and why a lot of these survivors are never diagnosed with trauma.
Why is your institute's trauma treatment so successful?
I had a unique treatment background. When I first started out of grad school, I actually worked in the field of psychopathology, working with people who had personality disorders, working with people with psychopathy, and then eventually began working with their partners who had been traumatized, in the relationship. And something about both of those, having the knowledge base of psychopathology and being trauma trained was a great mix for this particular group. And so I think that it's just the blend, sort of the blends of my prior training. We have taken, what has worked and developed a model of care treatment approach that we are now teaching other therapists and getting them up to speed on psychopathology so that they can have the same types of knowledge bases that were so helpful in our early treatment of these survivors.
So, what are the options for trauma treatment? Do you do that with a counselor? Do you do that? I know your institute also has a treatment, an online treatment program.
Mm-hmm.
What are the options for treatment if you realize that you have, or if your counselor says that you have been, that is what would be appropriate?
Right. So specifically within sort of the narcissistic and psychopathic abuse field, the training, the actual training for therapists is relatively new. Since January, when it launched, we've trained 1,200 therapists since January. And will be developing a database of trained therapists at survivortreatment.com that survivors can go to when the therapists are all done with their training. So in the meantime, our trauma surveys indicated that 75% of the survivors coming out of these relationships have trauma symptoms or trauma disorders. And so, you know, I think the first and foremost thing is for survivors to recognize that there's such a high percentage of trauma disorders being generated in these relationships that they should probably get assessed in order to do that. And as far as trauma treatment, lots of things. It's an exciting time to be in trauma over the last 10, 15 years. Lots of great treatment breakthroughs. And, you know, trauma is sort of like Baskin Robbins 57 flavors. I mean, there's a lot of different approaches that you could, a survivor could look towards. EMDR, which is eye movement desensitization reprocessing, rapid reduction, somatic, a lot of different somatic processing as well. And so there's lots of different choices as far as the types of trauma treatment. You know, back in the 80s, it was talk therapy, and that was, you know, about it. And today, there's so many options.
And Sandra, is the treatment for relationship trauma different from the other kinds of all the different types of trauma that exist?
Well, in the work that we do and with narcissistic and psychopathic abuse, the trauma portion of treatment, part of it is pretty typical with trauma. But what has made this different is the atypical aspects of trauma. And so in that regard, our treatment is different because we have to deal with some of the atypical parts that you don't normally see in other forms of trauma. And a big part of this trauma reduction program also hinges on pathology education for the survivors so they can understand the nature of their partner's disorder and why what happened in the development of their trauma.
So when you go to a counselor, what do you say? What do you ask them about? If you think that you have been traumatized, what do you ask the counselor?
Well, I would share that experience of trauma and your own questioning as to whether or not you do have trauma, because that's, you know, an important issue for treatment, and not all therapists are trained in trauma. So it's important to ask up front if you're sort of thinking you might have trauma. I would say look for a trauma therapist and get assessed. It's, you know, fairly quick. That way you're hooking up with the right kind of counselor if you in fact do have a trauma disorder.
Well, thank you very much, Sandra. I also want to thank you for making your new ebook on early recovery available free to our attendees. And I can only say that, you know, attendees, grab it. I sat down and read the whole thing in one sitting. It's a page turner, and that you are sharing this with us, your early, you know, work in trauma, Sandra. We can't thank you enough for making this available. This is not available to the public at this time, correct?
Yes, correct.
And will this one day be part of a book that you do on trauma, do you think, or?
I am never doing another book.
Okay, okay.
The
All the more
last one
important
was,
to grab it now.
yeah, the last one was 422 pages. Yeah.
Okay, all righty. So the link to Sandra's early recovery book is under the Sandra's bio on our website. And I think it's like find out more about the presenters, and then you click on that, and then there's Sandra's bio, and it's right there. And Zuri's putting a link in the chat here also.
Yeah.
And additionally, it's on on the attendees online event page in Eventbrite. So you've got 3 places to find it. Boy, grab it. I would say grab it. Thank you very much, Sandra.
Thank you. Thank you.
We are wrapping up now. Thank you to all our esteemed panelists and to all of our new friends joining us. This webinar will be available on YouTube, on our YouTube channel, and we encourage you to share it with as many people as possible. The link will be provided to you. The link to the YouTube video will be provided to you in an email once it becomes available. And you'll also receive a brief survey, and we would greatly appreciate your feedback. Now there's going to be a quick 10-minute break while we all grab our tea, our juice, our wine, and then enter the Mindfulness Lounge for a lively interactive Q&A session. That is when you may address any of the speakers. If you have not already registered for the lounge, again, you can check the chat for the link to register free for the Mindfulness Lounge. Since this is our first Mindfulness Lounge, we are inviting you to join free. We want to thank also the Arts and Business Council in Miami and Books and Books for their continued partnership. We hope you will join us after the holiday season for our January 22nd event, Women Authors Across Cultures. Where are we going? That event will be in person as well as online. We do expect it to sell out, so please don't wait. People are already registering for it now, the day that we put it up. You can learn more and register now on our website, powerandconnection.org. And please don't forget to donate on Give Miami-Dade. GiveMiamiDade.org/powerandconnection, starting on November 15th on early giving day. So we'll see you right back here in 10 minutes in the lounge. Alrighty, bye.